The class 1B drugs include lidocaine, tocinide, and mexiletine. Lidocaine is always given parenterally, and the oral form and mexiletine. It is used first line for the treatment of ventricular arrhythmias or tachycardias during acute myocardial infarction, and is a drug of choice for arrhythmias in the emergency room following amiodarone. The class 1B drugs blocks the voltage-gated sodium channels that are inactivated. Because the state-dependent blockade, lidocaine will work on slightly depolarized or ischemic tissue more than normal. For this particular reason, these tissues have a higher threshold for depolarization. As a result, this usually refers to ischemic tissue or those tissues that have had a myocardial infarct. The rate of dissociation from the sodium channels is very rapid and will not affect normal conduction. Action potential duration is reduced and increase in diastole. Lidocaine is very rapidly metabolized by amidases in the liver. IV infusion can be given, or it can be given IM, and the normal plasma half-life is about 2 hours. Elimination is slowed if there is impeded blood flow to the liver, such as in situations of cardiac output. Always monitor lidocaine therapy for safe use. CNS side effects are common, and long-term use of tocinide is associated with neutropenia and thrombocytopenia. The class 1C antiarrhythmics are seldom used, which includes flecainide, encainide, propafenone, and morphine. They are effective in both atrial and ventricular arrhythmias. However, they are only approved for refractory ventricular tachycardias that will progress to fibrillation. They are very pro-arrhythmogenic, and flecainide particularly has to be with extreme caution. And they will cause dizziness, blurred vision, headaches, and nausea, and may have a negative inotropic effect. The class 2 antiarrhythmics include esmolol, propranolol, and metoprolol, which are your beta blockers. They work at the nodal tissue and will control ventricular rate in atrial fibrillation, flutter, and during excess sympathetic activation. They are used to reduce mortality in patients who had a myocardial infarct because there is reduced oxidative damage in cardiac tissue. They will reduce the size of the myocardial infarct. The blockade of the beta receptors, or the antagonism of the beta receptors in cardiac tissue, will reduce the accumulation of cyclic AMP, which reduces the sodium and calcium currents. Propranolol basically may cause bronchospasms, so therefore we need to switch to a beta 1 selective. Bradycardia may happen. Depression and fatigue may also happen. Propranolol will exacerbate asthma and COPD and will mask symptoms of hypoglycemia. The class 3 drugs are the potassium channel blockers, which include sotalol, ibutilide, dofetilide, bertyl, and amiodarone. They are potassium channel blockers and will slow phase 3 repolarization and prolong the action of the potential duration and ERP. Sotalol is a potassium channel blocker and also a beta blocker. It has a racemic form that is somewhat less effective than amiodarone in preventing chronic ventricular tachyarrhythmia. Amiodarone is recommended for severe refractory supraventricular tachycardias. It is extensively used, and it has anti-anginal effects as well as antiarrhythmic. The problem with amiodarone, it contains 20% iodine and is structurally related to thyroxine. It can be used for life-threatening arrhythmias. It's very highly bound in tissues and has an extensive volume of distribution, which means that it can cause delayed toxicity even after you switch amiodarone off, because it will slowly leak out of its sequestered form in adipose tissue. Thyroid abnormalities may happen, both hypo and hyperthyroidism, photosensitivity, and it causes smurfism, which is basically blue pigmentation of the skin, and that is because of the iodine component reacting with starch. Amiodarone is also associated with pulmonary fibrosis, particularly in long-term use, and hepatitis and corneal deposits. Class 4 drugs are your calcium channel blockers, verapamil. Verapamil is the only antiarrhythmic drug or class 4 drug that is cardiospecific and is used for the long-term control of supraventricular tachycardia. It will slow AV conduction and can be used in atrial fibrillation and can be given orally or even